renowned pediatrician and neonatologist here at C.K Birla Hospital, Gurugram. I am Narayana Pawar from EIS 51 and I am here with my co-host Siddhi Yadav.
So ma'am, my first question to you is that what are the most common steps that we can take to prevent ourselves from mosquito-borne diseases?
So the most important steps that we should be taking to prevent ourselves from the mosquito-borne infections or mosquito-related infections, they include we should be wearing full-sleeve clothes. We should be applying mosquito repellents. Any child who's more than 2 years, they can apply mosquito repellents on their skin so as to protect themselves from the insect bites. The other thing is, after 2 years of age, we can always use vaporizers at our home. Also during night, we can use mosquito nets. Plus, there should not be any water puddles in our house, none in the bathroom or the balcony, or there should not be any water accumulation anywhere in the house. Plus, the food and water which is there for consumption at our house, it should be properly covered.
And doctor, what are your best tips to maintain hygiene and cleanliness during this season?
So, this question can be approached in two ways. One is the environmental hygiene and the other is the personal hygiene. For personal hygiene, anyone should be taking a bath daily. They should be using soap, water, Dettol and Savlon. That should not be used. These things should not be used. But soap and water are good enough. And plus, the nails should be properly trimmed and properly cut. About the environmental hygiene, the house should be clean and dry. The clothes that we are wearing, they should not be damp, they should be dry. Plus, there should not be any water puddles. The house should be properly
Okay, ma'am. So my next question to you is that what are the most common diseases that people are facing during the monsoon season?
So during monsoons, there can be waterborne infections, foodborne infections, airborne, insect-related infections, and also skin diseases. For example, there are many cases of upper respiratory tract infections now, common cold, viral fever. Then there's a gastroenteritis, loose motions, vomiting, pain in the abdomen, then typhoid, malaria, hepatitis, fungal infections, eczema, asthma and allergies. So these are very common during this season.
And ma'am, as we all know, diet plays a very huge role in our life. So what should we include in our diet during this monsoon season to keep ourselves healthy?
The first point is we should always prefer home-based hygienic food. The food should be properly cooked, it should be served warm and fresh. Plus, we should always prefer seasonal fruits and vegetables. Seasonal fruits, for example, lychee, jamun, cherries, plums, peaches, papaya. And seasonal vegetables, they include lauki, tori, jhanda, kandola, karela, parval, potato, sweet potato. So these are the seasonal vegetables that should be preferred. Also non-seasonal vegetables and fruits. For example, watermelon, melon and mangoes, they should be avoided during this season. Whatever we are eating, it should be properly washed and before being used. We should avoid using spinach, cabbage, cauliflower because there are many hidden germs there. Also, the spices like garlic and ginger, they are very good. Dry fruits are very good. They should be consumed. Plus, outside foods and beverages, including momos and chuskis and golas, so they should be avoided.
So today, Dr. Shreya has given us a lot of tips on monsoon season challenges. Thank you, Dr. Shreya.
Thank you, Narayana, and thank you, Siddhi. You have been wonderful.
Thank you.